A federal judge says part of Idaho's near-total abortion ban is unconstitutional. The ruling comes after a June trial where a Boise physician challenged the state's law. The Defense of Life Act makes performing or attempting an abortion after about 6 weeks of pregnancy a criminal offense with certain exceptions. The judge says the law can prevent doctors from providing medically necessary care in some circumstances, while the state has argued the law protects unborn life and should remain in place. Cooper Morgan reports on the ruling and what it can mean for patients and doctors across Idaho.
It started with Dr. Stacy Seib, a Boise maternal fetal medicine specialist who filed this lawsuit in 2024. Treating high-risk pregnancies himself, he testified Idaho's abortion laws can stop doctors from providing care even when a patient's health is on the line.
Idaho is known to have something that we call the twin prohibitions on abortion care. And those two laws restrict the ability of a woman to obtain an abortion in Idaho when it's medically indicated.
This week, U.S. District Judge B. Lynn Windmill ruled that women have a constitutional right to what he calls a health-preserving abortion.
This ruling has importance that rivals Roe versus Wade. It rivals Dobbs. This is one of the most significant abortion rights rulings in the country's history.
Windmill found that American law has long made room for abortions needed to protect a woman's health. The judge says that history means the Constitution protects abortions when they're medically necessary. Under the ruling, Idaho cannot enforce its abortion bans when a doctor determines that continuing a pregnancy could cause serious and lasting harm. That includes serious mental health conditions, including a risk of suicide. But there are clear limits to what this decision changes. The ruling does not protect abortions when the fetus has a fatal or life-limiting diagnosis. The court acknowledged that sometimes even fetuses with grave conditions may occasionally live for days, weeks, or months after birth, and that the court's role is not to determine what is a meaningful life. So what does this mean for patients right now? Even Mitchell says it's too soon to know exactly how fast things will change inside Idaho clinics.
So we're still evaluating exactly how the ruling will impact medical practice in Idaho, and that involves a review of what legal recourse is available after this initial ruling.